Okay. All right. I think everyone is in. Ruth, would you mind just monitoring the chat for me and the waiting room? I think you should have access to that. Okay. Awesome. Welcome. My name is Annie Lindy Kugel. I use she, her pronouns, and I am the executive director for the Community Services Network. Today is March 19th, and we have our March monthly learning session. And we have some awesome presenters today. Super excited to have them here today. We have Multnomah County Elections, Scotty Sherrington. We have Lift Up, Stephanie Barr. We have the Oregon Food Bank, Courtney Wright. We have William Temple House, Emily Sunderman. And we have 211, Kara Kangas. So thanks so much for being here. And I'm not going to go into too many other details today. We're just going to go ahead and get right into our presenters. So thank you again. And as always, we will share all of the slides shared today in a follow-up email. So just so everyone knows. Okay, so first up, we have Multnomah County Elections and Scotty Sherrington. Thanks so much, Scotty, for being here.
Annie, good morning, everyone. As Annie said, my name is Scotty Sherrington. I'm the Voter Education and Outreach Lead for Multnomah County Elections. Is my screen showing well for everyone? Excellent. So we are with Multnomah County Elections, which is and I noticed that some of you are probably in Washington and Clackamas County. You also have an elections office in the state of Oregon. Every county has an elections office that runs all of its state, federal, and local elections. Here in Multnomah County, we maintain a voter registration list of over 580,000 voters in our county, and we have the highest voter turnout in Oregon State, mostly because we have the highest number of voters. A little bit about what we do in our voter education and outreach program. We focus our efforts on providing voter registration and education to support to the communities that show lower voter turnout. We have an approach using a racial equity lens and using a trauma-informed outreach approach to build trust with communities who have not historically participated in voting, noting that there can be many, many barriers that keep people from engaging in the electoral process. And we have a very diverse community here in Multnomah County. Who are we focused on reaching? What does that mean right now? Due to the fairly recent Oregon Voter Act, which I believe is in 2016, we were able to automatically register most voters that were eligible if they had a state ID or a driver's license. So we have a nearly 97% rate of voter registration for eligible voters here in Multnomah County. But one of the challenges with that voter participation is that not everyone actually returns their ballot. So even though we send out that many ballots, we show pretty big disparities in communities that are participating in that. And we calculate voter participation by returning a ballot, and that ballot is filled out correctly so that we can count it. We send out ballots to every registered voter in Multnomah County, but as we said, we see a big variable rate in the ballot return, mostly by geographic area. We then utilize data from the US Census American Community Survey to better understand the voters in those areas. And that was a result of producing what's called our vote map. It stands for Voter Opportunity, Turnout, and Engagement. It allowed us to really look at where are voters not turning in their ballots, and then what do those communities look like, so that we could provide targeted direct outreach to those communities that was appropriate in language, education access, those sort of elements. This picture here shows the voter turnout rate for the May 2022 primary. The darker colors are a higher turnout, so the lighter colors are the low participation. There's not too many indicators on here, but you can see pretty clearly that East Portland is and parts of Western Gresham have the lowest voter participation. It's not a whole lot different between the primary and the general election. There's the November 22 general election, so same area. You're seeing we have a slightly higher turnout when it comes to general elections than primary elections. But still, we're seeing pretty big disparities in East Portland and East Multnomah County of rates of return of those ballots that we're sending out. So those are the areas that we're really concentrated on doing our outreach and our programming in. And how we do that and how we can work together with groups like you all on this call today is that we hope to build relationships with organizations who have already built trust with these voters, the same voters that we are trying to reach. So our questions really for you all, do you currently serve the voters that we are trying to reach? Can we provide voter registration training to your staff? Is voter registration or information something that we can fold into how you are already communicating with the folks that you are serving? Or can you collect voter registration cards at your events or places of service? I think one thing we're concerned about with, even though we have automatic voter registration through the DMV, folks still are not returning their ballots. And a lot of those ballots are being returned to us because the address isn't correct. So even though folks are initially getting registered, keeping that registration up to date so that it's accurate and they're receiving their ballot is really important. And having those service points all across East Portland and East Multnomah County will be very helpful to help remind people to update their voter registration. Or can you host a presentation or workshop for the community that you serve? That's another element that allows us to get a little bit deeper into the weeds with folks, right? And so that we can get in front of them and answer those questions and work with them individually and we're in groups to find those barriers and the reasons why folks aren't participating in voting. And a big piece of it is the communication. You can support us and support voting by following us and sharing us on our social media platforms and our press releases and pushing folks to our website. If you have a regular newsletter, can we provide content for that? That's another big way that we can utilize your networks to get our information out to folks. But mostly remind folks that we're here to help them to access their ballot and feel confident in their ability to fill out their ballot and return it successfully. A couple of the other services that we have through Multnomah County Elections is our language assistance services. We have many multilingual staff and we always have interpretation available during our open office hours at both of our locations. We have a location that's at Southeast Morrison, in about 10th and Southeast Morrison. And we also have a location out in East Multnomah County that we open at the Gresham Health Center, right at the end of the Max line there. And that's called our Voting Center Express. And that opens just right around each election period to provide customer service, ballot replacement, and assistance to our East Multnomah County voters. We also have our voter assistance team. That is a group of folks that helps folks fill out their ballot where they are. So whether that's going into an assisted living center, into individual people's homes, any situation where someone needs help filling out their ballot, that's what that team is for. So we can utilize them as well. And then also one of our biggest assets here in Multnomah County is our libraries. So our librarians have been trained on how to assist folks with voter registration and even how to complete their ballots. And also every single one of our libraries in Multnomah County is an official drop site for ballots. So some important information that's very pertinent that's coming up right now is that we have a closed primary election here in Multnomah County this May. So what is a closed primary election? In Oregon State, a closed primary election will require voters to be affiliated with a major political party to vote in that election. The major political parties that are in Oregon are the Republican and the Democratic Party. Both of those parties hold their primary election to determine who will be on the general ballot. This year, we have a primary election for the US president, for some US Senate seats and some US representative seats. In other years, our primary election will be for the Oregon governor or the Secretary of State and certain state Senate and representatives. So voters need to determine their political party affiliation by April 30th to receive their party's primary ballot. If they're not associated with that with that political party, then they will just get a general ballot that has things that they can vote on that are not related to a primary. And those would be measures and any elected office that is not associated with a party. We have some nonpartisan local offices that folks can run for. So that's the real big one for this primary in November is a lot of people don't understand that in order to participate in the primary, they have to be affiliated with that party. And they can change their political party affiliation at any time by going to OregonVotes.gov. So as I said, the next Election is May 21st. That's our primary election, with the voter registration deadline on April 30th. And that is it for my presentation.
I love it. This is such an important year for folks to be registered, as every year is, but this one is specific. And also, if you have, I saw there was I think a question in the chat from Stephanie. If we serve hard to reach populations in parts of town that already have high turnout, would you still be willing to provide training to our staff?
Absolutely, yes. We will provide training to anyone in Multnomah County. It's just usually with our staff, as far as outreach events, we really try to focus on those communities that are not showing current participation. We were always willing to train any organization that is willing to take on voter registration or election communication to anybody in Multnomah County. Yeah, so great question. Thank you.
Awesome. And I would say if you are interested in having Scotty or Scotty's team come out and do a presentation or voter registration on site, or kind of the variety of different offerings they have, feel free to drop your email in the chat and then I will send that to Scotty afterwards. Sometimes that's easier than always just taking Scotty's email. So feel free to do that right now if you have a moment and are interested. And in the meantime, are there any other questions for Scotty? Okay, awesome. Thank you so much, Scotty. Super appreciate you being here. And it looks like we've got some emails to send over to you afterwards. So we'll share those with you. Awesome. Okay, next up we have Lift Up with Stephanie Barr.
Good morning, everybody. I'll pull up my screen and everybody see.
Awesome. Thanks so much for being here, Stephanie.
Thanks so much for the invitation. So I'm Stephanie Barr. I use she, her pronouns, and I am the executive director of Lift Urban Portland, Lift Up. And our mission is to reduce hunger and improve the lives of our low-income neighbors in downtown and northwest Portland. This is our small but mighty team, and I'm going to use our annual report as a way to walk through what we do. So,
awesome. And Stephanie, I'm sorry, is there a way maybe to make your screen a little bigger? I don't know if others are having the same. My eyes maybe are perfect. Is that better for everyone? Okay, great. Thank you so much. Sorry for the interruption.
Oh, thanks for letting me know. So we operate a shopping style pantry in Goose Hollow neighborhood inside First United Methodist Church that's open 3 days a week. So we are open Tuesdays, Thursdays, and Fridays. And I emphasize shopping style because it's really important to us that we are not trying to control people's access to food. We see it as not our food, but food that belongs to the community. And so we're only placing limits if we need to in order to serve everyone. But for the most part, our philosophy is abundance and choice as much as possible. We served almost 12,000 people in fiscal year 22-23. In calendar year, that's shot up over 13,000. So we definitely have been growing. We serve a diverse community. A lot of the people that we're serving are seniors. A lot of folks have disabilities, and a quarter of all of our regular pantry shoppers are Chinese immigrants who speak Mandarin. So we work really hard to provide culturally relevant foods for our community. And we actually have a new partnership with a farm that's growing some food for that community specifically in this next growing season. So we're really excited about that. We do offer appointments on Tuesdays for people that need assistance shopping. The other days we operate on a lottery system, which just determines when people shop, but we do our best to serve everyone who shows up. And we're open from 3 to 6 p.m. I'm happy to answer questions more about that. We also, the other main way that we support our community with food security is through our Adopt a Building program. So we provide food security services on site in 50 low-income housing buildings across downtown and northwest Portland. 30 of those we consider adopted, which means that we have the resources to provide our full slate of services. And that includes delivered food boxes to the doors of residents who would have difficulty getting out to a pantry in the community, usually because of age or disability. We are delivering over 400 boxes every month across those buildings. We mostly, our clients are seniors, and 44% of them were tailored to meet dietary restrictions. I think in the next year we're gonna hit half of all of them are gonna be tailored to meet some kind of dietary need. And that's really important because a lot of people, myself included, have special diets and can't consume a lot of the things that might otherwise be available. Also, a lot of seniors have chronic health conditions that need to be managed in part by their diet. So you can see we're really proud of the results that we have around people being able to consume more produce and reporting that they're better able to manage their chronic health conditions because of the food that we provide. We also stock mini pantries in 30 of those buildings. Those pantries are accessible to anyone who's living in the building, ideally anytime they have a need for food. Building staff partner with us around access, and then we also have residents who volunteer with us to help manage access to those pantries. Those are really busy towards the end of the month when folks' benefits run out. And then our Supper Club program operates in 30 buildings as well, and that is a 4-part cooking and nutrition education series designed to build community and to increase people's knowledge about how to prepare foods that they can access through Lift Up in ways that are nourishing to them. One of our housing partners described the community that we serve as the most densely populated but socially isolated part of Portland, and I think the pandemic has only exacerbated that. So this is one of the ways that we use food to create social connections and decrease that sense of isolation that a lot of our neighbors experience. A couple other things. This is Natasha, our Supper Club coordinator, preparing food in one of the buildings. People report that they're more likely to prepare foods at home and that they've learned new ways to meet their nutritional needs through Supper Club. And then this is Jack. Jack is one of Lift Up's board members, and he's also a resident advocate. Through some seed money we received from Oregon Food Bank with their capacity building grant a couple years ago, we started our resident advocate program. And that's a leadership council of residents in the buildings that we serve that partner with us to help facilitate food access for their neighbors. And this group is now about 15 members that meets monthly. They share tips with each other about what's going on in their buildings, what works, what's challenging, and then they advise us on what their community's needs are, and they know better than anybody. So it's been really amazing to have this leadership council of advocates. And we're hoping to help them connect with more opportunities to do legislative advocacy as well, because we've heard that that is a priority for them and us. And then finally, community share. We moved into a larger warehouse in Industrial Northwest last year, and that is allowing us to help redistribute food to some of our mutual aid partners. So now we have the space to take on bigger donations and can redirect it to other partners in addition to using it to support our programs. ERCO is one of our biggest partners, but we deliver to Milk Crate Kitchen, OHSU's Student Pantry, DeRose Community Center, a few other sites. I think that is the bulk of what I wanted to share. I'm gonna, sorry, I'm gonna stop sharing and ask if anybody has any questions. We do on our website, if you have connections to a resident who lives in affordable housing in our service area and you think they might be eligible for a delivered food box, we now have the ability for people to refer themselves to learn more about that program on our website. So I encourage you to check that out and refer people there if you think they're experiencing food insecurity and would have difficulty getting to a pantry.
Awesome. And there's another question, Jody in the chat said, do people need to be within a specific neighborhood to go to your shopping pantry?
Don't turn anyone away, but the way that food systems work, they're really designed to be in neighborhoods and serving that local community. So Lift Up is focused on serving downtown and Northwest Portland. So we would let them shop that day, but we would also give them information about what pantry is maybe closer to where they
Awesome. Leanne, would you like to go ahead?
Sure. I just had a question. I think, if I understood correctly, you do some education, if I heard that correctly, about preparing food. Did I miss? Okay, good. All right. So I'm wondering if we work with families and we work with parents who are struggling with everything. And so I'm just wondering, is that something that you do? Do you do any outreach with families or with groups like ours to maybe help better educate how we can then share that information with them?
Yeah, that's a great
Trainings, I guess trainings and education, I'm curious about.
Yeah, our commitment is to serve the residents of the buildings that we partner with. So we actually go into, for example, Bud Clark Commons or the Vibrant and do that cooking class there to build community there and to just lower the barriers for them. We don't have the capacity, unfortunately, to offer that same service externally, but we do have some incredible resources that our Supper Club coordinator created, including a beautiful booklet that has recipes and has tips and has been informed by the residents. So I'd be happy to share that. And we have it available in multiple languages as well.
Oh, that would be wonderful. Thank you. How would you like, should I just contact you directly or how would you like to do that?
Yeah, you can pop your email in there, I'll write it down, or you can reach out to me by email and I'll get it to you.
Great. All right. Thank you so much.
Awesome. Thanks, Leanne. And Marlon.
Thank you. Hi, Stephanie. I had a question. I love what you guys do. I've actually been to your food pantry. It's amazing that the one you guys have over there by the Providence Park. And I did want to ask, when you guys deliver food to those residents, do you guys provide like veggies and fruits and like meats, like real grocery, maybe I guess is the best way of putting it that way, that are not just canned foods?
Yeah, thank you. I can't believe I missed that because I'm so proud of it. Almost half of the food we distributed last year was produce. So each resident is getting a box of shelf-stable food and a bag of fresh perishables. And it's about 50 pounds of food with every delivery. And it is like the heaviest, biggest free bag you can imagine that has fresh fruits and vegetables, dairy products, meat products. And we tailor to the degree that as much as we can. So sometimes it's like this person has celiac, soft food diet, and hates spicy foods. And it's like, great, we got you covered. So yeah, we want people to receive food they'll actually enjoy. And
Thank you so much. I really appreciate that.
Awesome. Okay, there's a couple other questions in the chat from Laura. Do you partner with nonprofits outside of Northwest Portland?
I mean, I think the one thing about Lift Up that's been consistent since we were founded is that we're really focused on serving downtown and Northwest. So the community share or the community food hub model is the way that we partner with organizations beyond our service area. So like ERCO isn't necessarily rooted in downtown and Northwest, but they receive food from us and that supports their programs. So that would be the primary way that we have an impact and partner beyond downtown.
Okay, awesome. And then one last question. Would you have capacity to add other buildings to your partnership that are in your service area?
We are working on it. We are in growth mode and we already, like I said, we have some touch point in 50 buildings and we're serving only 30 at full capacity. So we have a roster of buildings that we're already trying to procure the resources to scale up in. If you have a specific building in mind and you want to reach out to me, I'd be happy to chat about that and see where it might fit in our plans. But we don't have capacity right this minute to like go full force in a new building.
Perfect. And Stephanie, if you wouldn't mind putting your email in the chat, or if folks, if you want Stephanie to reach out to you, I can send your email to Stephanie. You can put that in the chat. Just make sure you put for Stephanie.
And I believe on the website where we talk about delivered food boxes, if you go to find food and you're acting like you want to sign up for delivered food boxes, there should be the roster of buildings that we currently serve. So we might actually be there at some level already.
Good point. Yeah, that's awesome. Awesome. Okay. Thank you so much. I love what you do and just super appreciate you being here and sharing today. So thank you, Stephanie, very much. Awesome. Okay. And like I said, we will share these slides and Stephanie's report afterwards so you can have additional information. So next up, we have Courtney Wright with the Oregon Food Bank. Thanks,
Good
Courtney, so
morning.
much for being here.
Yeah, thanks everyone. I don't have a full set of slides. I'll maybe pop in some links to websites and things like that for folks, but lovely to be here. Thanks for having me. Oregon Food Bank is a statewide organization that serves 21 regional food banks around the state of Oregon, plus Clark County, Washington, because they're so close. And 5 of those regional food banks are owned and operated by Oregon Food Bank. There are branches, and that includes our Metro Services branch that serves Multnomah and Washington County, or excuse me, Multnomah and Clackamas County, our Washington County branch, and then we have Tillamook, the Gorge, and Eastern Oregon and Ontario. Hi, Johnny. Sorry, former colleague. And I work with the Metro Services branch. My job is basically to be a liaison between our partner agencies, who are the programs that are have gone through training and orientation and are certified basically to receive food from Oregon Food Bank. So we are the distribution hub of food through all those regional food banks, who then distribute to their partner agencies as well. So I get to work with Multnomah County and wonderful programs like LIFT and William Temple House and many other amazing pantries, meal programs, and then other programs, free food markets that serve the community in the metro area. So we are, I know one question from a lot of folks is going to be, how do I become a partner agency? And right now we're at capacity for taking on new partners. As everyone is painfully aware, after the SNAP cuts last March, I can't believe that's been a whole year now, that the need for food has skyrocketed, and our agencies are seeing, more clients over the last year than they saw even in peak pandemic levels. So I tell folks I can't always add more partners to the program because I don't necessarily get more food. And so it just makes the amount of food I can give to new agencies and everyone else smaller and smaller. So we are working to make more space and get more food in, but that takes time. And we do have a sign up form that I can share if folks are interested in being on a wait list. But the best thing I can offer folks now, excuse me, is our food finder, which is our website that shows across the state all of the, I want to say we have about 1,200 partner agencies that receive food through their regional food bank and Oregon Food Bank. So you can go in and, if you have a client with you that needs food today, you can click on the pickup days and say, Tuesday, I need to see what's open today, right now. You can sort by zip code. You can sort by the type. Do you need a meal? Do you need just a pantry? What are the different options? So you can use that to find food, as soon as today or tomorrow. And then what clients can expect when they get there is maybe they have a sign-in sheet. A lot of our food pantries, there is an income verification required because of one of our food streams. It's only verbal. They just ask, do you meet these requirements? And they say yes, and they're good. They share their address, at least zip code is what's asked for that, just for some data purposes. If folks feel like they want to do it anonymously, they can do that as well. You're never asked to provide proof of income. You're never asked to show an ID. That is not required to access food in our network. So if you ever encounter that or your clients do, please reach out to our main line, because that is absolutely not allowed. We want folks to feel comfortable and welcomed. And different pantries are set up in different ways. The way Lyft is operates is wonderful and amazing. We have some that offer a pre-packed food box for folks that maybe just need to come pick up and go because they don't have the time to stand maybe in a line or wait in a line to get their food. So there are client choice pantries. There's kind of grab and go. One of the ones that I like to highlight is Portland Open Bible Community Pantry on 92nd and Powell. They have an online ordering form that clients can fill out, make some selections around what works for them for their dietary and cultural needs, and then they can pick the drive-through pickup option that their box is packed, and then they can go pick that up later. Some sites do offer delivery. That's more challenging, I think, capacity-wise. But the food finder would point out if there's some of the St. Vincent de Paul network has some delivery options in there. So yeah, that's sort of how clients can interact. I do want to point out, and I'll link this in after I'm done, that if you need to pick up on behalf of a client, that is allowable and doable. I'll link the form that's called the authorized representative form. It just says that the client fills that out, verifies they're meeting those income requirements, and then you take that to the pantry and share that with them. I always recommend folks call ahead and make sure that pantry is able to do that and has that capability, and then how many clients that they can have you shop for. Some can do 10, some can only do 1, and it just kind of depends on the pantry that you're working with. So always a call ahead, I think, is appreciated for those sites. And Food Finder has all that contact information on there as well. So, but I'll link that form, and I have it in a couple of different languages also. The other thing Oregon Food Bank has really been leaning into is our advocacy work, because we know that there are so many root causes affecting hunger. It's not just not having enough food, but we all know, employment, healthcare, racism, sexism, all of the things that go into the root causes of hunger. So we have a team, an advocacy team that is working on addressing some of those issues. We just wrapped up the short session, and so our team was advocating for the school meal summer meal program that passed through the legislature, and I think it's around 200,000 more kids will have access to summer meals this year. Working on other issues around housing and things like that, and advocating for those things. We do have what we call Ending Hunger Power Nights, which are a way for the community to get involved if folks are interested in learning about advocacy. Those are, I think, monthly phone calls, Zoom calls that folks can join, hear about different topics and issues and how they can get involved. They are interpreted into, I think, 3 different languages. I'll share that link in a moment too. So that's a great way for you all or to share with clients if they want to start working on some of those issues. I think the next one, we are not this session, but we're gearing up for 2025 already, and bringing back the Food for All Oregonians campaign, which we helped advocate for this last year at the long session, and that is to bring SNAP to more Oregonians and giving more people access. So regardless of immigration status or where you were born, that you would have access to SNAP. So we're hoping to bring that back to the legislature. We weren't successful this last year, but that coalition is gearing up again, and that's the topic of the next session coming up. So if folks want to learn more about that, I'll link that in there. And I think I'll pause there.
So much good stuff. I love it. I love it. I love it. Thank you so much, Courtney. It looks like there's a couple questions. Leanne would like to know where to find the authorization form to allow us to pick up on behalf of a client.
I'll link that in the chat in just a few minutes for sure. Yeah.
Perfect. Awesome. And any other questions for Courtney? Just check in the chat. Any other questions? I personally love the Food Finder portion of the website. I think it's so helpful. And it's just really well laid out. So good job to all of you for that, because that's a huge undertaking to not only do, but to maintain. Yeah. So great. Any questions real quick before we move along? Okay, sorry, someone's stuck in the waiting room. Thank you. Okay, awesome. So if you, Courtney, if you wouldn't mind just putting, oh, did you put your email in the chat? Great. That way folks can reach out to you with any follow-up questions. And thank you so much for being here and for the work that you do. Appreciate it. Okay, next up we have William Temple House. We have Emily Sunderman. Emily, are you on?
Hi. Hello, I'm on.
Thank you so much. Thanks so much for being here.
Share my screen here. All right, can everybody hear me and see my screen okay? Wonderful.
Yes.
Well, hello, I'm Emily Sunderman. I use she, her pronouns, and I'm the social services coordinator and resource navigator with William Temple House. We're located at 2023 Northwest Hoyt in Portland. And our vision is that everyone in our community is fully nourished. Our mission is to provide food, counseling, clothing, and household items to our Portland area neighbors to strengthen our community. And I'm going to focus primarily on our food-related services today, but I'm happy to answer any questions folks might have regarding our counseling as well. The counseling services are pay as you can and are open to individuals, families, and couples. And let's see, many people are often familiar with our thrift store already. That partially funds our community services, so we always encourage people to shop there. We also offer resource navigation and peer support, and I'll mention those a little bit at the end. Oh, sorry, I'm not doing well advancing my slides. So a little information about our food pantry. It's a low barrier shopping style food pantry. It's open 3 days a week, Tuesday, Wednesday, and Thursday from 11 to 2. And we welcome everyone to attend. There are no age or zip code restrictions to shop in our pantry. We serve a very diverse population of clients, including many unhoused folks, seniors, and those living with disabilities. We partnered with OFB as an LGBTQ affirming agency, and we use a trauma-informed approach to all of our services, and we really try to offer foods that are culturally and dietarily diverse whenever we can. As Courtney has mentioned, there's no ID or proof of income necessary to access the pantries. And we do offer dry goods, fresh produce, frozen items, including meat, dairy products, and some ready-to-eat items when they're available. We also have hygiene items, some pet supplies, and emergency clothing. In addition to our our partnership with Oregon Food Bank, we glean food from several area grocery stores, including Trader Joe's, Amazon, and Fred Meyer. Clients can shop for themselves or make a shopping list twice per month. Clients who have exceeded their twice per month shopping limit can still receive a pre-made bag of food with 4 customizable options, as well as clothing and hygiene. And you're welcome to refer your clients to us. Okay. So a little information about the pantry procedures. So the shopping order for the pantry is determined by a lottery system, and we open the gates 10 minutes before pantry starts to pass out numbers, and clients usually start shopping around 11. Those who choose to make a shopping list do not have to wait for their number to be called. And we do allow folks to shop on behalf of other people, including social workers, case managers. We ask that you shop for 2 clients per visit, just because that's about what we can handle with our capacity right now. The wait times can vary, but they can be pretty significant on really busy days, sometimes up to 1 to 2 hours. And we do encourage clients to shop, or excuse me, to arrive by 12:30 to shop for themselves. That is kind of subject to change depending on the number of clients we have visiting us that day, and also our staff and volunteer capacity. We rely heavily on volunteers. So moving along. We can only accommodate about 75 individuals each day to shop, and 25 shopping lists and 45 pre-made bags. And again, that we have to kind of vary that depending on our availability of staff and volunteers. But we do try really hard not to turn anyone away empty-handed. We try to encourage people to arrive by 1:30, but often we're putting bags of food through the gate after we've already closed at 2. We just really don't like to send people away without food. And we really also try not to limit the amount of food that clients can take. We let people take an unlimited amount of most produce and dry goods. We do have to limit some items just because we want there to be food for everybody. And so we really just try to not limit what people can take. They can take what they like. So a little bit of information about our clients, like I mentioned, they come from very diverse backgrounds. About 15% have identified as having a disability. 36% receive SNAP benefits, and 4% speak Mandarin or Cantonese. So I just want to mention quickly our navigation services, partly because that is a big part of my job. They are really quite broad what we can provide. We use a trauma-informed approach to connecting our clients with resources in the Portland metro area. A lot of our services are really geared towards Multnomah County residents, but I will make referrals if I can for Washington and Clackamas and Clark County. We offer assistance and support to clients with locating resources and accessing government, state, and local programs, as well as helping them use those benefits. We provide formal and informal referrals to many local nonprofits and other social service organizations. We can assist with completing applications and forms, making resumes, uploading and emailing documents, and solving technology issues. Really all over the place with what I try to provide to our clients. We can answer questions on a variety of topics. I have clients come to me with all kinds of needs, and I just really try to make sure that their needs are met. Unfortunately, we don't offer financial assistance. We're just not set up for that. It would be great if we could. So for navigation, I see clients on a drop-in basis during our food pantry hours and by appointment outside of pantry hours. Thursday is typically the best day to come in. The end of the week tends to be the least busy time in the pantry. And then in addition to our navigation, we have peer support from MHAAO during pantry hours. It's a really great resource for a lot of our clients. I highly recommend our peer support. So another aspect of navigation and our food security services is that this year we have officially become SNAP outreach partners with DHS. We can assist with applications, support clients in calling DHS, which can often be kind of an arduous process. We answer questions, and we can help them collect and submit all their documents. We can't conduct official interviews or make the final determination of benefits. And similar to our navigation services, we offer SNAP services during our food pantry and by appointment outside of pantry hours. Thursday is our dedicated SNAP outreach day. Right now I have 2 interns from PSU, and they often assist with navigation and SNAP outreach, and they're also both here on Thursday. So there'll be 3 people trained to assist clients if they choose to come in that day. I have a little bit of information from our last year's impact report. Over 4,000 people received food assistance, and 39% of those were new to us. So we have definitely seen a lot of increase in accessing services. I think our average daily total has doubled during the 2 years that I've been here, which has been in the post-pandemic / SNAP change period. Goodness, this is a big number here, over 500,000 pounds of food distributed in over 13,000 visits from clients. So we're really proud of that number, definitely. And then something we do right now, we're having to put it on hiatus, unfortunately, but we do connect people with utility assistance through Impact Northwest, and you can see quite a large number there for the dollar amounts of assistance we helped people with last year. And then we were new to the SNAP partnership last year, but we did have 628, oh, excuse me, this is our navigation number, I'm sorry. 628 unique visits to navigation last year. So we're pretty proud of that number. Some quotes from our clients. Let you guys take a look at those. We're pretty proud of our relationship with our clients. A lot of them have been coming here a really long time. William Temple House has been an organization since 1965. So we have a pretty extensive history with some of our clients. And we do offer volunteer opportunities, both for individuals and groups. We love our volunteers. We couldn't do this without them. So we definitely welcome anyone who might like to volunteer. And of course, you can shop at the thrift store to support us that way. And subscribe to our newsletter, follow us on social media. We can come to your facility for a SNAP Outreach Day, or you're welcome to recommend your clients to us. And help us spread the word. Thank you. That is it for me.
Awesome. Thank you so much, Emily. Super appreciate you being here. And I think we have one question. Let's see, my screen just shifted. How do we become referral community partners from Marlon?
Oh, great. Okay. Well, so we don't really have a formal referral process. Is this for navigation, or I guess either way? You can certainly call me or email me. I could put my information in the chat. I field a lot of the questions regarding how to be referral partners with us for all aspects of the things that we do here. So I will drop all that information in the chat here.
Thank you. Yeah, I seen it's because you had said that we could pick up food for like our clients and stuff like that. And then I heard like you guys help out with resume with some more stuff. So I'm like, oh my God, you guys have a lot of good stuff. So
Yeah, thank you. So as Courtney mentioned, there is a little bit of paperwork to have clients, to be able to shop for clients. We have the authorized rep form. And then if they aren't already in the OFB system, there is a little bit of paperwork. The information is voluntary. We try to get a name and date of birth so they can go in the database, but it's not required. We can do it anonymously. The authorized rep form, though, we do need. I can send it to people. I'm happy to do that. Or I think Courtney was going to give access to it also. It's the same one that she has.
okay. But yeah, can I get your information, Emily? I would also appreciate that.
Absolutely. I put it in the chat right now.
Perfect. Thanks, Emily, so much. Super appreciate that. And those numbers are amazing. So kudos to you and your team. Such great work from you and your team and all of the presenters that shared today. I just super appreciate all that you all do. So thank you. Okay, and next up we have Kara Kangas from 211. Kara, are you on?
Yes, I'm here.
Great. Awesome. Thank you very much for being here.
Yep. Thanks, Annie. Hi, everybody. I'm Kara Kangas. I am the Director of Partnerships with 211 Info. I use she, her pronouns. And today I'll just be giving a brief overview of our services. I'm hoping everyone here is familiar with 211. I even noticed my coworker, Gabby Valdez, is here. Gabby's our SNAP coordinator. And yeah, I'll talk a little bit about our programs, including our coordination center, which is a part of Connect Oregon. So 211 Info, we're an independent nonprofit, and you can see our mission statement there. We're a 24/7 service that provides 211 phone service to the state of Oregon, as well as a partner with Washington 211. And so we also provide 211 service to Clark, Cowlitz, Skamania, and Wahkiakum counties in Southwest Washington. And similar to other 3-digit numbers, 211 was designated by the FCC in 2000 to be the 3-digit number for community resources. So about 99% of the US is covered by 211 services. All of Canada is covered by 211 and Puerto Rico as well. In some areas, 311 exists for government non-emergency services, depending on where you are. And so if you're not sure where to turn, just dial 211 and we'll get you connected to the right place. So why might you use 211? So really, it's all about accessing the right information at the right time to help the people that you're serving. And so folks may contact us, for the first time, for the 5th time, maybe they've exhausted all of their options and they're not really sure what to do. Call 211 and you'll reach us live 24/7. We have multilingual staff. All of our staff live throughout Oregon and Southwest Washington. And while we are still remote, we have some folks who come into our office near Cascade Station in Portland. And I am always open to providing tours of the office if anyone is interested or would like a meeting space. Pre-pandemic, we were around 60 employees and now we're over 150. So we've definitely expanded a lot of our programs, a lot of our emergency incident response, COVID-19 response, and a lot of our specialty programs around housing, food access, veteran support, foster parent support, maternal and child health, and a lot of things in between, childcare as well. How to contact. So calling 211, there's also a toll-free number as well. You can text your zip code to 898-211. You can email help@211info.org. Text messages and emails are available Monday through Friday, 9 a.m. to 5 p.m. and are also in English and Spanish. You can also visit our website and search our database at 211info.org or download our free mobile app on the Google Play or the Apple Store. We also have language interpretation by phone. So within the agency, we have staff who speak Portuguese, Hungarian, Mandarin, Samoan, and Spanish. And then we contract with 3 other language service providers that have access to over 240 languages, along with ASL. So what we offer, we like to talk about our 4 capabilities. We have our contact center. So when you're first contacting 211 with questions about community resources, and then we're pulling those resources from our database that is curated by about a team of 20 staff. They spend over 12,000 hours a year updating this database. It's updated on a daily basis. And so we receive information from our call center staff, from outreach staff, from folks in the community about new resources or updates to resources. We also create partnerships with agencies that are listed in the database, which it's free for them to be listed. We just ask that they update at least once a year, but they're more than welcome to update as often as they like. We also have a robust community engagement and outreach team, which I'm happy to be a part of, and I know Gabby's a part of as well. So we are living and working in the communities we serve and representing 211 Info at presentations like these, at tabling events, back to school fairs, veteran stand downs, health and safety fairs, farmers markets, faith-based services, and just out and about promoting 211 and how to access us. And we also have data and reporting. And so you can actually visit our website and check out our data dashboard to see who's calling in your county, what they are requesting, what the top services are that are being referred to, unmet needs as well, and then some demographic information. And if you're more interested in more detailed reports, or maybe you want to dial down to a zip code, there's contact information on our website and we can create tailored reports. So some of our core programs that I've mentioned a little bit earlier, we provide some statewide access for childcare referrals, SNAP and food access if folks have challenges to accessing SNAP benefits or maybe barriers through ODHS or just questions about food access. You can call 211 and leave a message with Gabby. We have our maternal and child health program. So this also focuses on reproductive and sexual health, childhood immunizations, kindergarten readiness, baby supplies, diapers, you name it. We have a 24/7 statewide foster parent support line. So for folks who are fostering or resource parents and need access to an advocate, and maybe their person is not available after hours, they can contact 211 and speak with a resource parent support person. We provide assistance with coordinated entry in multiple counties. Multnomah County for families, households with children. And then we also help maintain the wait list for the Gretchen Women's Shelter. We also partner with Clackamas County for coordinated entry, and then Lane County as well. Disaster services, so this includes severe weather, cold, heat, air quality, COVID-19. We've also been involved in other emergency incident response around drinking water, the Eclipse Hotline in 2017, wildfires, and we have a contract with ODHS to basically stand up our phone line and begin taking phone calls in any jurisdiction to answer questions, frequently asked questions, in the hopes of rerouting those calls away from 911 if it's not an emergency, and getting people that right information at the right time. We also have a 24/7 pesticide reporting hotline, kind of a unique outlier, but it's through the state's Department of Agriculture. So if folks have questions about pesticide use or what constitutes a pesticide, they can give us a call. And then our coordination center, which I'll talk a little bit about next. So this is a partnership with Unite Us, which is a tech company out of New York. And so Unite Us as a platform is used within our coordination center, and it's also used by our Lane County Coordinated Entry Housing team. So basically, it's a piece of technology where with the general 211 service, when you contact 211, it's anonymous and confidential. With the coordination center, using Unite Us as a piece of technology, now we're on a first name basis with our client. Now we can provide information referrals, but we can send referrals on behalf of the client within the platform. And then we can track outcomes of what happens with those services. So it's care coordination with a little bit of light touch of case management, because we're documenting the outcomes. We're documenting case notes around what was the experience like for the person who was seeking services, what kind of barriers did they have, and then in real time, we can report to their healthcare provider who might have sent the referral initially to the coordination center about the services they received. And then also, everyone who's involved in that care coordination of that client can see the entire journey for these services. I also learned yesterday that for the Oregon's Medicaid 1115 waiver with HRSN services, that we have access to the form, the request form for HRSN for Medicaid recipients that we can fill out within Unite Us. And so we've been partnering with OHA to make sure we have all the correct information about how to message HRSN services to Medicaid recipients. And so the climate benefit just went live on March 1st. And so the form is available on OHA's website, which we also have listed in our database. So if you call 211 and folks are asking about climate related devices, we can provide that information. Or if they would like to work with a coordination center, a care coordinator to help fill out that form, we can submit that form on their behalf. And then, so focusing on our other capabilities, our resource database, which I mentioned, over 2,500 agencies providing resource information and updates to over 25,000 resources across our 40 county region. Most recently, I believe the database, the annual updates rate, we have a staff person who checks that percentage every Thursday, just to make sure that we're staying up to date. And it was at 96.3% last week. So good job to our team updating over 2,500 agency records on a daily basis. And that means out of the 2,500, 96.3% of those have been updated within the last year. And for those who haven't responded to the automatic emails that go out to update their database, our outreach team, community engagement team, our specialty coordinators are outreaching to those agencies actively to ensure that the information we have listed is the most up to date, and to help them update those records on their own. Talked a lot about our outreach and engagement, and they can also provide multilingual materials. They can do site visits. They can sit side by side with staff or virtually and provide trainings on our website, our mobile app, how to update a record if they're listed in the database, and then provide presentations and attend tabling events as well too. And then our data and reporting, if you want to hone in on customized reports around demographic information or consumer needs, this is all public information that's available on our website as well. And then just for some quick data points, these were our top 5 requested needs in 2023. Housing is always in the top 3, followed by utility assistance, food and meals, healthcare resources, and then legal, consumer, and public safety. And we had close to 400,000 contacts across all of our channels during 2023 that identified over 660,000 unique needs. Other than that, we are on social media, so feel free to follow us on your favorite platform, and feel free to also scan that QR code to provide feedback on this presentation. We're always loving to hear from all of the folks out there. Thank you so much.
Thank you so much, Kara. Just appreciate that a lot. Are there any questions for Kara?
Looks like there might have been a question about the VI SPDAT assessment. So this is a vulnerability index, and it is completed by our mobile housing team. So folks that contact 211 who identify as a family with children, what happens is if they meet the eligibility criteria, they will be on a 72-hour callback list. And then one of our mobile housing team staff will call them back and go through the VI SPDAT assessment with them. And basically, it's a 15 to 20-minute conversation and questionnaire that is entered into HMIS or Service Point. And it essentially rates their vulnerability based on periods of homelessness, how many times within the last 3 years, are they chronically homeless? Are there any other factors that are impeding their ability to maintain or retain safe and stable housing? And so once that VI SPDAT is complete, folks are placed into a housing pool. And the pool essentially means that a lot of folks might be waiting, and one person may have a higher vulnerability than the next. And then as programs within the county open up, folks that are eligible may be routed toward those programs. And so HMIS in Multnomah County and then in other counties is used by a lot of different social service agencies who receive funding for housing programs. It could be permanent supportive housing for people with disabilities. It could be rapid rehousing for folks experiencing homelessness. It could be prevention dollars for keeping people in their homes to avoid eviction. So just depending on what funding's available, what programs are available, that VI SPDAT is going to give a score to that person and that household and assess their vulnerability. And I see Bruce with their hand up.
Yes, hello. Thank you. I really appreciate the scope of 211. When I first found out about it, I was like beside myself almost. I'm quite involved in Washington County's civic activist world, and I got a few questions. The funding for 211 seems to be stable and improving. Does it all come from United Way, or what? I didn't see any mention of funding partners.
Yeah, that's a really great question. So historically, and even currently across the US, so we're an independent nonprofit. And in the past, a lot of our funding was through United Ways, United Way Columbia Willamette, and then a lot of the United Way chapters throughout Oregon. As the United Way changed their funding model, they were funding more and more direct services through social service agencies. They were pulling back funding from 211 Info and then other agencies too. And so with that, we looked at changing or updating our funding model about 8 years ago to a sole source contractor that is available to contract with any state agency, county agency, government agency within the state of Oregon through the Department of Administrative Services. So what that means is if a county or a statewide agency wants to contract with us, we essentially have this menu of items that we can provide, a pricing list for our staff, that means setting up a call center. So one example, the Oregon Health Authority. When the pandemic started, we were asked to start taking phone calls, and they wanted to know, how many staff will you need? We need you open 8 a.m. to 5 p.m. We don't think it'll be a highly used phone number. This isn't going to last very long. And so we quickly realized that was going to change. But with a DAS price agreement, that means a lot of our contracts and our services are funded by these multi-year contracts through state agencies, to ensure we have services and staff available to answer those phone calls, emails, questions, and provide outreach for the services. We also do receive legislature appropriations through the state of Oregon and the state of Washington. Washington 211 also provides funding for us to have services. We also receive some county funding, so Clackamas County, Lane County, Clark County, Washington, and then some healthcare and CCO funding. So Kaiser Permanente funds a coordination center, Health Share of Oregon, and then Columbia Pacific CCO. And I believe the grant we received from United Way last year accounted for less than 0.05% of our budget. So yeah, it's definitely a lot less, but they're still partners for us and still promote 211. And you will see a lot of 211 shops under umbrellas of United Ways, depending on where you are.
I was going to ask about your relationship with the CCOs, and one of the great fears I have is that organizations start up and they duplicate services that other agencies are doing. And it sounds like 211 has become a center hub for this kind of service dissemination, which I think is fabulous. I'm curious what kind of training your employees get. I did call 211 as an older person looking to maximize my food money, and I got a call back, and I didn't answer the first one, and I got a second call back, and I was really appreciative of it. It was more of a test than a sincere need, but I was quite heartened by it. So when somebody wants to become a 211 operator, what's the training regime that goes on?
Yeah, that's a great question. So we do on our website have current job openings at this time for a myriad of positions. And as a person comes into the agency, they're going to go through about 3 to 4 months of side-by-side training. And yeah, anyone in our agency who will work in outreach, who might work on our resource team, if they're frontline staff on the phones, or if they're in childcare, or if they're in an admin position, they're going to be learning how to take phone calls. So they're going to be shadowing calls, listening. Once they get comfortable, they'll start driving the call, meaning the other staff person will be talking, and then the trainee will be searching for resources in the database, and then they'll switch at some point. And then eventually they'll go through so many shadowing hours where then they'll be on the phones on their own with a trainer shadowing them. Because essentially we're an agency that is all hands on deck. If there is a crisis, a public health emergency, and our call volume increases, or even during times of non-crisis when there's higher wait times, we have a phase system, so more and more staff can hop on and essentially try to get those wait times to come down. Average wait time now is only about 2 minutes or so, 1.5 to 2 minutes. During times of emergency incident response, it can definitely vary. And so as folks go through training, they are learning a lot about all the specialty programs that I mentioned. They're learning about helpful taxonomy terms to search through the database. They are going through trauma-informed training around how to escalate phone calls if folks identify as being harmful to themselves or to other people, child abuse, adult abuse, vulnerabilities. They're learning about how. Go ahead.
You would pass those off to is it the 988 number, the suicide hotline?
Yeah, so we have triage in place and protocols in place. So if someone is identifying as reporting suicidal ideations or harm to another person, we let them know our boundaries. We let them know that we're all mandatory reporters through the state of Oregon, and that at this point, this is when we would break confidentiality to get them to the next safest place.
Cool.
And so we would.
So 211 is organized on a state by state basis. The state. And I'm really grateful that you've gone into Clark County. That is such a natural part of the metropolitan area.
Yes,
The
yes.
CCOs have overcome a lot of the geographic limitations to define, good functional boundaries for these things. And I'm grateful for that.
Yeah, yeah.
I could probably keep asking questions, but I appreciate your answers here.
Sure.
And I wish you the best of luck in the amazing work that you're doing.
Thank you so much. And I will drop my email address in the chat. So if you have, or if anyone has any other questions I didn't get to today, I'm more than happy to answer them for you.
Thank you.
Yeah, thanks.
Thanks so much, Kara. One quick question for you. We kind of talked about this when we met last time around ways that folks can help 211 make sure that the information is up to date to the best of their ability, because that tends to be kind of the outerlying frustration that that I hear from folks in the community. So would you mind sharing that a little bit?
Sure, yeah. And I just also put the email address in the chat, which goes directly to our resource team. It's support@211info.org. And so if your agency is listed and you're curious to see what it looks like, any of our outreach team could do a side-by-side training with you to show you how to update that information. If you're the person responsible, or if you know who is responsible for updating that information, or if in your travels you are checking out our website or our mobile app, and if you see inaccuracies or if you see a spelling error or grammatical error, let us know. Feel free to email us at support@211info.org, and we will take all that feedback, and then what happens is that information is manually updated by our staff every day. Or if there's a special event or a resource you think would be great for an addition to the 211 Info database, it is a shared database. And so it is as good as the public and our staff can keep it up to date. And so we want to make sure that it is reflective of communities, that it is inclusive, and it has as much information as possible.
Thank you. And one more question. So if they want to share a resource or an event, how early do they need to get that to you? What's the timeline to get that to you? And then what's the timeline to get it posted?
Sure. Yeah. So if it's let's say maybe a public safety fair or a back to school fair or something, a veteran stand down, we do subscribe to multiple mailing lists. So more than likely we'll have that information listed in our database. If it's something maybe that's quick, that's happening tomorrow or this weekend, well, we might not be able to get it listed in our database. We will publicize it on social media. So I would say,
is there a calendar that lists those?
we don't have a calendar, community calendar. That's something Annie and I have been talking about recently, like who might be the owner of that calendar and how might submissions be accepted. And so a lot of times when we're posting social or large events, we'd like to have them in the database at least a few weeks before the start of the event, because folks contact us and want to know, where can I get school supplies, or where can I get mobile dental care, or screenings for mental health, substance use. And so, even if it's a week out, I mean, we can get that listed. But if it's a pretty quick turnaround, we will definitely publicize it on social media.
So it's Facebook and Instagram and
Facebook and Instagram. So Twitter, we notice, or X, it's highly used during severe weather. So when there's cold snaps or heat or wildfire, a lot of government agencies go back to Twitter, X. And so that's when we see a lot of traffic as well. Instagram, a lot of agencies use Instagram, and they will share information in their stories about events coming up. Facebook is hit or miss. It really depends on the algorithm and when things are posted. And so we've been testing different times, posting videos, if it's a get to know you video, or if it's information about a social service coming up. We definitely share those a lot in Instagram stories as well too. But yeah, we just try, let's try Thursday at 1:30 and see what happens, and then, check our stats. But yeah.
All the data behind it. It's
yes.
it's trial and error for sure.
It's interesting. Yeah.
Sure. The data really does help to
Mhm.
better understand it. So
For sure. Yeah.
awesome. One more comment for folks too in checking out your website. You do have a great dashboard, and we use that when we're planning fairs, as well as our data to see if it is similar, and it often is, especially in the unmet needs category. So just they've done a lot. You've done a lot to update your website in the last few years. So if you have a moment, take a peek at it and see if it might help in your planning stages as well for events and things like that. And like Kara said, we have been in conversations about a calendar, public facing calendar, and we know that there's a lot of different groups and digital referral systems or digital platforms, digital navigation tools. And so there are, conversations around kind of how do we kind of move forward in these spaces and make it easier for all of you to tap into these resources. So know that that's happening behind the scenes. And thank you so much, Kara, for your information and for sharing today. Any last minute questions for Kara or any of the presenters today? Okay, awesome. And Kara, you have, yep, your emails in the chat. Great, thank you so much. And just thank you to all of our presenters today. I will share the slides following this in an email, as well as the chat to those who left their emails for the presenters. Super appreciate you. Just a reminder, the CSN does have 2 job openings posted. We are closing that on the 24th. I do know that the Care Oregon one did close temporarily. I am talking to them about making sure that stays open until the 24th. So just know that I'm aware of that, getting that fixed on our side. And just appreciate all the work that all of you do day in and day out. And thank you so much for being here. All right. Have a great Tuesday. Thanks again. Take care.